Hello, friends. Welcome to another episode. Today I have Rachel Smith on the podcast. And let me introduce you before we talk about this really important, really interesting conversation that I'm personally excited for. And I know a lot of you have been asking questions about this, about the connection between our physical symptoms and trauma. So let me introduce Rachel. Rachel is a functional diagnostic nutrition practitioner and owner of Natural Health Rising, an online functional medicine practice that serves clients worldwide. After putting her own autoimmune disease into remission, she has now helped hundreds of others naturally reverse their symptoms of autoimmune disease, mold illness, and other chronic health challenges. Rachel's unique RISE approach involves utilizing functional medicine, lab testing, nutrition, lifestyle changes, nervous system work, healing hidden infections, and detoxing from environmental toxins in order to help clients heal and thrive. Rachel, welcome on the podcast.
Thank you so much for having me on the show, Becky.
You're welcome. So, just quickly, we won't dive into this too deep, but just personally, what was it that you were dealing with? What symptoms, what kind of autoimmune stuff did you have going on?
Sure. I I've gotten a diagnosis of Hashimoto's, which is an autoimmune disease of the thyroid. And for me, I grew up what I would call a pretty sick kid. I always had lots of problems. Always had lung issues. I had digestive issues, um, asthma for a while, just lots of weird stuff. And then as I got into my late teens, it felt like even though I was an athlete, I thought I was eating pretty healthy. I was taking care of my body. It just seemed like things were actually getting worse and worse and worse. And so between like late teens, early 20s, my hair was falling out. I had brain fog. I remember going to college and having to go in my car between classes and nap. I would even fall asleep in my classes sometimes. I was so fatigued, which is like really weird for me because I was a straight A, high achieving student. So I actually wanted to be there. I had heart palpitations, trouble swallowing. I started developing like numbness and tingling in my limbs. So it was just like this very, very long list of symptoms. Also, didn't even have a period for about 3 years at one point. And I had gone to dozens of doctors. I had gone to the emergency room multiple times, just getting all sorts of different tests done. And every single time, doctors always told me that my blood work was fine and there was nothing really they could do for me. And also, they look at me and my age and say, well, you're so young. You're fine. It's kind of just in your head, or maybe we could just give you a pill for that. But there was really no answer for me. So I started to try different diets on my own. I started listening to a boatload of podcasts in my late teens, early 20s, and was just implementing anything I could. I would take cold showers. I would meditate. And this is like a decade ago. I was meditating. I was doing everything. And then finally started to learn about autoimmunity a little bit and the thyroid. And I started saying, oh, I think there is a thyroid connection here, but I'm not really sure. And one night I had heart palpitations in the middle of the night that were so bad. My heart was racing. It was probably like 160 beats per minute. I called 911 because I thought I was having a heart attack at, 21, 22 years old, and got rushed to the hospital. And they wound up doing an exploratory heart surgery on me. And they didn't find anything wrong with my heart. So for me, that was the final straw. I was like, this is crazy. I can't trust conventional medicine anymore. Yeah, I know. And wound up researching the like top thyroid functional medicine specialist in Florida at the time. Went to him with my story, and even he was skeptical of my age, but he ran all the labs and 100% confirmed Hashimoto's diagnosis. That's where I started learning about gut health, changing your diet, changing your lifestyle. And within like a few months of me making changes, my symptoms started going away. And my journey was much longer than a few months for sure to get my body to optimal health, but that was the pivotal moment for me that made me dive into all of this. And now I get to help other people heal their bodies in a similar way.
That's super fascinating. So, just personally, what that makes me think of, I don't know if you've done this or heard of it, but thermography scans. Have you ever done or heard of them?
Mhm.
Yeah.
Heard of them? I haven't done them personally.
Yeah, so it is scanning your body's temperature, and my husband actually uses this as a home inspector, a home inspection to see. He uses it as a home inspector to see if there's like certain parts of the house that are hotter, more radiation than others. And anyway, it's a way of scanning without any radiation, without any like a mammogram, will have radiation in it.
Yes.
This is a radiation-free way to see are there any spots in my body that are hotter than others, meaning there might be something there to look at. And so the first time I ever did it was a couple years ago, and it came up right here. I know people can't see, but I'm touching my throat, my thyroid. And I remember them saying, yeah, you might want to see what's going on in your thyroid. And this was at the beginning of my somatic healing journey, which sounds similar to your, awakening. It was when I found somatic work that so much started to heal trauma-wise and physically. Um, but I hadn't dove too deep into it yet. So all I did was get a blood test, and blood test came back normal. They said your thyroid is fine. And I was like, okay. And that's where I left it. I didn't really know what to do after that. I came back to get a thermography like a year and a half later, and this was just after trying to practice nervous system regulation and deepen, somatic embodiment. And it had shrunk so much that like red heat space. So there was still a little bit right here in my thyroid area, but it wasn't as big. And so it leaves me with this question because you said the blood work came back normal. Um,
Hmm.
Yet there is still clearly a problem. And I know so many people. I can relate to you and me, what we just shared. So what does one do when the blood work comes back normal, but they like know something is off? Are you suggesting that they do something else instead?
Hmm. Yeah. So if somebody's dealing with a bunch of mystery symptoms, is what I like to call it, it could very well be an autoimmune disease. But no matter what, I mean, at the end of the day, any autoimmune disease, any disease is really just a label of symptoms, right? So we want to identify, why is your body being dysregulated? What's causing all these weird symptoms to pop up, whether you have a diagnosis or not? And this is where functional medicine is really life changing because with the right testing, we can look at things going on internally that is not blood work. And that's looking at certain gut testing. We know that there is a gut dysbiosis component, like a leaky gut component, to pretty much every autoimmune disease. We know that mineral and heavy metal testing is really important. Minerals are really the spark plugs of our cells. And if we don't have enough nutrients in our bodies, then it's almost like forgetting to put gasoline in your car or oil in your car, right? It's not, eventually it's going to run out of gas. It's not going to run properly. Any toxins built up are going to start to cause dysfunction in, let's say, your thyroid, for example, or other organs and systems. And so, looking at some of these tests, I like to use the GI map. I like to use organic acids testing, hair tissue mineral analysis testing. Those are just a few things that can help us look way deeper into the body and start to heal these things internally, which is really going to address the root causes. And then there is definitely a mental emotional component to all of this as well. And I know you want to dive deeper into that too.
Yeah, 100%. And before we get there, I know this is what comes up, just roadblocks for myself when I hear this, because it's been something I've wanted to dive into for years, just into functional medicine and getting tested. And I hear that from so many people, like get your gut
Mhm.
tested. And, it sounds great, but what immediately comes up in my head is, okay, what doctor do I go to? Is insurance going to cover any of it? And like which are the most important tests to get. So for me
Mhm.
personally, and also just anyone who's like, yeah, those that resistance comes up as well. Um, what are the very first baby steps that they can look into?
Yeah. Well, even backing up a little bit further than that, look at your whole life in general first. Like, what are you eating? Are you getting outside and getting sunlight every single day? Are you moving your body Do you have a lot of stress in your life? Can you start to incorporate a gentle breathwork practice daily or a meditation practice, something for stress relief? Are you drinking clean water? Like there's a lot of basic stuff. There's so much information online nowadays. Like I'm sure your podcast, my podcast, there's lots of free content out there where people can learn like, okay, what are the baby steps I can take in my food, sleep, water, stress, relationships? Can I look at my relationships? Like there's so many things you can look at before spending a bunch of money on testing. So starting there.
Yeah.
And if you feel like you've done a lot of those things, which those are typically my clients or the people who are like, yeah, I've done it. I've done it all. And I'm still hitting a roadblock. That's where I would look for a good functional medicine practitioner. Um, they're not all created equal, right? You might go to just like any career, you might go to one person and they run a couple tests on you, they give you a handful of supplements and send you on your way. Whereas somebody like me, for example, would do like really ask a lot of deep questions to make sure the right tests are getting done and then work with you holistically. So nutrition, lifestyle, nervous system, supplements, etc. It's not just like one thing that's going to fix somebody. So the testing that I like to start with are actually the three tests that I listed: the hair tissue mineral analysis test, which is a simple hair sample, the organic acids test, which is a urine sample, and a GI map, which is a stool sample.
Okay, that's super helpful. So you're saying, yeah, baseline first things to look at is those whole life indicators, the sun, the food, the stress, the movement, because you could have all the testing in the world, all the tools, but if those basic foundational things are out of whack, that's what we want to check first. Second, finding a
Mm-hmm.
functional medicine practitioner nearby, and they'll guide you, hopefully, if they're good, and ask a lot of questions to the most important test that you need to take first. So you have your favorites, which you listed, but it may be
Mm-hmm.
different, is what I'm hearing, right, for different people.
Well, one, you don't even need to find somebody nearby. You know, if you're going to someone in person, I would say they're most likely a functional medicine doctor versus nowadays we have people who are more like functional medicine health coaches. There's tons of people online. So you don't even have to run around to offices nowadays. For example, in my practice, it's all online and we just ship the labs to your doorstep. So super simple. And as far as base testing, I personally believe that the ones I listed are a really great starting place for everybody.
Okay, I love Instacart and Amazon Prime. And so if you're saying you're a functional medicine practitioner and you will ship those to my doorstep, we're gonna have to talk after.
That's
Um,
right.
But yeah, this is really helpful. Thank you for diving into that. And then, as far as the connection between autoimmune and trauma, so a lot of the women listening, women in my space, they have had symptoms for years. And it's just,
Mm-hmm.
in our Western world, none of us are trained or taught to like look deeper into those symptoms to see if there is some kind of emotional connection. We are very conditioned to pop a pill or take some kind of medicine or put a band-aid on the symptom as if the symptom is a threat or some pesky house rat that we need to shoo out of the house. When
Mm-hmm.
really our body is always talking to us and has so much wisdom to share. And the women that I
Mm-hmm.
work with, we tend to look under the hood. They start to practice that pause of, hold on. What's my body potentially telling me? And they find this whole world of emotional, wisdom or wounds that still need to be healed or next steps. And so, one of the most common questions I get that I would love to hear your perspective on is just how do I know if a physical symptom is purely physical or if it is connected to some kind of traumatic root?
Mm. Yeah, that's a really good question. And it's kind of hard to answer without like sitting in front of somebody and knowing their entire health history, to be honest, and what they're doing in their life. But what I can tell you is that I can give you some stats and some information. So research suggests that 80% of people with autoimmune diseases report significant emotional stress before their diagnosis. Research also shows that as your ACEs go up, so your adverse childhood experiences, this increases your likelihood of developing an autoimmune disease. So the more ACEs, the more increased risk of autoimmunity and also other chronic health conditions like lung disease, heart disease, cancer, diabetes. Have you talked about ACEs on your show before?
No, no,
Like,
please expand.
okay, just a little bit about those. It's, when you're a child, it's those adverse experiences like physical abuse, emotional abuse, sexual abuse, neglect, even if you just have like a really dysfunctional household. Those are things that can increase that risk. And studies show that if you've experienced that childhood adversity and adulthood trauma, you're going to have higher levels of C reactive protein in your blood, which is an inflammation marker, than those who just have had adulthood trauma alone. So,
Hmm.
that formative years of your life as a child, if you have traumatic experiences, it really impacts your health significantly, drives up inflammation, and drives up any risk of chronic disease. Um, have you guys talked about like do you use the polyvagal theory?
Yes. Yeah, the polyvagal is big. We talk about, I'm looking at my shelf right now. I have all these copies of The Body Keeps the Score. So, yes, please talk polyvagal.
Okay. So there are definitely some ways that you can look at your life on a daily basis to kind of see what your nervous system is doing. And that relates to how our health is and how our body's functioning. So, you have the kind of the three main states, right? You have the ventral vagal state, which is safe and social. This is the parasympathetic nervous system that most people know of as rest and digest. And so it's called rest and digest because your body is in this state where if you eat food, you're going to break it down. Your enzymes are being produced. You're going to digest that food. You're going to absorb your nutrients. So you're going to be nice and nourished. Your immune system is actually optimal and strong. So if you encounter some sort of infection, any microbes, your body's going to be able to keep you healthy. And this is just a place where we can heal. And so in this state, you should feel connected to others. You should feel calm. You should feel safe. Your breathing is nice and regulated. You feel able to communicate clearly and openly. So those are some signs. If you feel like that, that's where you're at.
Yeah.
Then we can drop into, say, the sympathetic state, like fight or flight, where our body is perceiving some sort of danger. And in this state, we might feel anxious, worried, fearful, irritable, angry. And in this state, now our immune system decreases. So direct impact on the immune system immediately. Your body doesn't care about digesting food anymore because it's in this protective state. Thinks, oh, I need to run away or protect myself. So it's like we don't need to absorb nutrients. We don't need the immune system to function properly. We just got to get out of here. Heart rate increases, blood pressure increases. So if you're feeling any of those emotions, that anxiety a lot, feeling worried, fearful, irritable, we know that your nervous system is dysregulated. And that could be coming from past patterns of trauma, living in chronic stress, not dealing with your nervous system regulation, or not dealing with past things that have kind of shifted your nervous system into this state more often. And then you also have the dorsal vagal state, so that shutdown or freeze state. And very kind of similar to sympathetic with what it can do health wise. It's still gonna bring down immunity, and then other things kind of drop too. So like blood pressure, heart rate, because the body starts to kind of shut down, and that's feeling a little bit more like disconnected, numb, dissociated, and like exhausted. So if you can think about it in those kind of emotional states, that's where you can know, okay, maybe there is something emotionally or past or trauma wise or chronic stress wise that I'm not dealing with or don't know how to deal with, which is, we just don't know what we don't know. And that can be impacting our symptoms.
Yeah, I love that. Guys, if you're listening and you're not familiar with the polyvagal theory, just Google it right now and go save it. You'll see it's going to look like a bunch of traffic lights that pop up. It's usually in like red, yellow, and green. And it's an amazing tool just to even save on your phone to be able to check in at any minute and be like, okay, which state am I in? So many times I'll meet with a client and I'll share the screen and just pull that up and be like, where are you at today? And they're able to identify, wow, I'm
Mm,
totally shut down. Like I'm depressed. I don't want to get out of bed. I feel unmotivated. And we're able to start there. We know where we're beginning and to be able to honor the
Mhm.
wisdom of our nervous system moving into that state in the first place. Um, because so many times, I'm sure you get this too, or have even felt it, Rachel, there can be so much shame associated with being out of regulation. If we're in that
Mhm.
fight or flight state of anxiety or anger, irritation. It's not only the pain of that experience, that emotional discomfort, but then it's like we come around and shoot ourselves with this second arrow of shame for feeling that in the first place. Like, what's wrong with me? Why am I so anxious? Or why can't I just be chill? Same thing for the shutdown. Like, oh my gosh, I'm a high achiever and I know I could be so much more productive than this. Why can't I get out of bed? So the first thing we want to do is honor the wisdom of it and know that this is natural. Like everything Rachel just so beautifully described is how animals respond in the animal kingdom. If you look up again on Google, if you're an animal lover, maybe you don't want to do this, but animals playing dead, they will go into that dorsal vagal shutdown as a way to survive. If they know that fight or flight is not an option, or if they actually are about to get killed, it's their nervous system's way of shutting off pain, which is kind of nature's mercy that they won't feel pain if they actually are going to get killed. And so each state is wise and it's a recognition of, okay, this we're here for a reason, for good reason. We're not dramatic or we're not, labeling ourselves here, but also the goal is to move back into that ventral vagal state Rachel's talking about where we can thrive and feel connected and um, curious and, creative. This is how we were meant to live for most of our lives and have the flexibility to respond to threats when we need to and self-protect, but then come back into safety. So I love what you said, and I pretty much just share the same thing, which is just check under the hood and see what's there. If you check under the hood and realize, oh, there are some emotional things coming up in my life right now, then awesome. Maybe you just need to slow down, ask for a hug, like just get some
Mhm.
girlfriend time if it's loneliness or whatever it is. But kind of like Rachel said, if you check all the bases of the foundational stuff, but you're still experiencing chronic anxiety or chronic fatigue or chronic depression, whatever it is, it may be time to, yeah, look further to the health side of it.
Mhm.
Something else,
Ye-
Rachel, go ahead. Yeah.
Oh no, I was just going to say I totally agree and want to double down on saying that it is a really beautiful natural protective mechanism, right? Like your body um, developed these responses in your life due to past experiences. And so it's not definitely not about shaming them, but about, like you said, noticing where you're at and then learning, okay, how do I work with this? And how do I develop a stronger, more resilient nervous system where I can kind of move myself back out of or back into a parasympathetic state if I'm noticing that I'm feeling a little bit dysregulated. And some of the things that I find helpful, one, if someone has a lot of big traumas, definitely seeing a professional EMDR therapist, someone who is really trauma informed. Any of those type of therapies is so helpful. Maybe somatic experiencing, other somatic work that I'm sure that you do. And then there's even things that you can do on your own, like the emotional freedom technique or tapping. You can learn how to, um, even learning like how to notice your emotions and express them and move through them instead of bottling them up and suppressing them, because those also, we can get into a whole nother conversation about how holding on to emotions can start to affect our different organs, right? Like grief affecting the lungs or frustration affecting the liver and different systems like that.
Yeah. Yes, yes, yes. It's fascinating. You mentioned it, so I'm going to go there for a second, but like grief being associated with the lungs, this heart space, this part of our body has like a whole world of emotional programming in it. It is where grief resides. It is where, our heart literally is, but also love programming. So, how our relationships are, how safe it feels to open our heart to others, or if we're feeling like we're closed hearted. And so it's interesting because this is a spot for so many women that is loud, or I don't know the word, but like just comes up a lot when I ask women to scan their bodies, like where is their symptoms? Where is there anything? Like so many go straight to the heart because they've been through either so much grief that they haven't had the guidance to process or know that it's possible even to complete grief. Or there's just been so much heartache that our body does hold on to that if we don't release it, if we don't process. So I love what you just spoke to. The stuff you can even do on your own is tapping, which if you're listening right now and you haven't done it, you can try it. Tapping like above your eyebrows and then on your temples just lightly with your fingertips and then under your eyes. If you Google EFT tapping, it'll show you the spots that are the power points to tap on. It's just different meridian points where our nerve bundles and energy intersects in our body. And so I just love what you're doing, Rachel. I love that you take this holistic approach to seeing women's whole lives, that they are not just this one singular, set of symptoms, but they have relationships and they're complex beings. And, this is humanity. And I was stalking your
Mhm.
Instagram, and one of the first things that jumped out to me and resonated the most, which I think you talk about a lot, but one reel in particular said, "You grew up in a chaotic household trying to be the peacemaker, became an overachiever to gain love, and turned into a people pleaser. Now you have an autoimmune disease." And I was like, damn, for anyone who knows the Enneagram, I test as a type 9, which is the nickname is the peacemaker. And I did grow up feeling like constantly in the middle of my mom and my dad. They were at odds and roommates, and I was constantly trying to keep the peace. I became super hyper achiever to the point of burnout and then just wanted to make everyone happy, terrified of conflict. And I don't
Mhm.
know if I have an autoimmune disease, but I'm in this space now where I'm diving into my health more than ever. And I'm noticing myself want to pick brains like from professionals like you. But if you could just speak to that before we land this plane today of how common that is of a bunch of women in our society, definitely the ones listening to this podcast, getting a shit ton of badges of honor throughout their life for being that overachiever, but then being like, oh shit, like I have zero energy, or I'm constantly pissed at my kids, or I have, acne breakout, like whatever it is. I would just love to hear what you've seen in your work.
Yeah. So obviously, I posted that reel because that was also me. So you're not alone in that. Um, the overachiever will typically run themselves into the ground and put themselves last, which can be seen as beautiful in times with family and right, taking care of your kids and your partner and all of these things. But if you don't take care of yourself, you are going to totally deplete yourself. And so some of the things that can happen with that is, we have our very delicate adrenal glands that produce our cortisol, which is part of our stress hormone response and also gives us energy throughout the day. And those adrenal glands can also produce some of our sex hormones and our DHEA, which is going to be anti inflammatory and help build our muscles and our testosterone levels. So we need to keep those adrenal glands functioning well. And when we are in a go, go, go state all the time, we're taking care of everyone else, we really stress ourselves out. We start to basically drain that tank if we don't replenish it. And replenishing it is taking some days off, doing self care, regulating your nervous system, meditating, breath work, whatever you like to do, spending time with your friends, your girlfriends, taking care of yourself. And when we don't replenish that tank over time, it drains. And so over time, we start to develop lower mineral levels and vitamin levels that we need for our adrenal glands. Our cortisol levels start to go down, our sex hormones start to go down. And all of a sudden, we wake up one day and our periods out of whack, we have no energy, our gut's a mess, and then one day you might have an autoimmune disease or something like that. So that's kind of the health picture of what can happen from that overachiever, people pleaser type of status.
Yeah. Yeah. So relatable to so many. And something that helped
Mm-hmm.
me, a little mantra that I used when I was in that transition period of crazy hustle mama to, oh my God, I actually want to slow down. At first, it felt like death and it felt very dangerous and unsafe to slow down. And I had to
Mm-hmm.
mantra myself to say, look, you can either choose to stop your body now or your body is going to stop you. You can choose to slow your body down now or your body is going to slow you down because it's innate wisdom and it's love for us. The nervous system will do that at some point if we don't take care of ourselves preventatively. So, guys, if you're listening, just to wrap this up, I loved Rachel's invitation to first just do a little litmus test of your life. Ask yourself, how much sun am I getting? You've probably seen the meme on Instagram, right? Of we're just overcomplicated houseplants. Like, do we
Mm-hmm.
have sun, clean food? How's our stress? Are we moving our body? Water clean, relationships? I love that just as a practical sink our teeth into. Let's reflect on that this week. And then if you start to really tend to those areas of your life and you're still noticing persistent symptoms, maybe seeking out functional medicine practitioner like Rachel and just asking for some guidance, just having a conversation about next steps and seeing what tests would even look like, cost, and all of that. So, Rachel, any last tips for a woman who is like, oh man, I'm relating to this. I've got some physical symptoms. I definitely have some trauma. What would be a good place to start?
Well, I would love to wrap up a couple things about maybe the high achiever people pleaser story because that might be a lot of people.
Yeah.
And there's some really simple things to do with that. One is, can you just open up your calendar today and sit and go through it and see when you read that task or that event or that thing you signed up to do later on this month, how does it make you feel in your body? When you read it, does it say, fuck yes, I can't wait to go do this and support my friend at their birthday party or go to the kids' soccer game and do whatever the activity is? Or is it like, I'm feeling a little unsure about that. That's kind of like a maybe for me. It's maybe giving me a little discomfort in my chest or in my gut. Is it like a full no where you know, like, oh, this person really drains me of my energy? And so those ones that are a definite no, can you take one of those off of your calendar? Can you start to say no to a couple of things? Or even if it's a maybe, if it's not a full fuck yes, it's a no in my mind. And anytime that someone comes up to you and asks you, hey, can you come do this for me? Or do you want to do this thing? A lot of the times the response is, yeah, sure. Right? People pleaser mode. Yeah, I'll do that. And then immediately after you go, oh man, why did I say yes to that? And so instead of saying yes immediately, you say no immediately and say, if anything changes in my schedule, I'll get back to you. That way, you don't have a lingering response or a follow up that you have to do. Instead, it's actually a no, and then you can change your mind and feel into your body more because a lot of times we're disconnected from that gut response, and so it gives you that space to really feel into yourself. And the final thing I'll say is to have more fun. Like if you take a couple of those no's off of your calendar, when is the last time you did something that really lit you up? Because if we do more things where we're having more fun, we're letting loose a little bit, we're going to lower our inflammation levels. We're going to boost our dopamine. We're going to do more for our body in those places than most supplements are going to do.
That's so good. I love that. I love that. I love that. I love that, Rachel. And yeah, just presencing and acknowledging if you're in a state where you can't even remember the last time you had fun, or you feel like I used to be a fun person, what happened? Or I've never been a fun person. Validate yourself for that because if you're in that place, it's not because you're just a tight ass with like a stick up your butt. It's Probably because you've been through enough experiences to put your body in survival mode. And when you're in that fight or flight or shut down, you're not thinking about having fun. If there's a bear in front of you, you're not thinking, ooh, how can I dance or kick a soccer ball or play a game? Like, it is not the state you've been in for good reason. So, being able to train your nervous system that there's actually not a bear in the room, that I have made it through whatever trauma I've survived, or if I am stuck currently in an unsafe situation, being able to first take steps to get out of that to safety so you can start to incorporate play again. It's such a huge, huge, huge piece of healing. Rachel, I
Yeah.
could talk to you for hours. Thank you so much for all of this wisdom you brought today. I really enjoyed getting to know you and having this conversation. And where can the people find you?
My business name is Natural Health Rising. So that is my name everywhere, naturalhealthrising.com. I'm pretty present on Instagram, TikTok, and YouTube. So you can just look for Natural Health Rising in all those places. And did I send you anything for the audience? I have a couple of things to give to people. So if somebody just wants like a short PDF that has some recipes in it and some holistic lifestyle tips, we've got the energy reboot plan, which is really great for everybody. And then if you have more of a serious condition going on, like autoimmune disease, or you're one of those people who doesn't know what's going on, it's a lot of chronic mystery symptoms, then I have the free autoimmune webinar. It's a little bit beefier, but it is packed with all of the lab testing I talked about, teaches you what every lab does, what you can ask for, also meal plans in there, supplement recommendations, lots of amazing free things. So go grab either of those to support you.
As I run to go do that. Rachel, thank you so much. Can't wait to chat further. And thank you for all you're bringing to the world.
My pleasure. Thanks for having me on, Becky.